Yeah, all good, buddy. I'm just at home on the Mac, so this is first time trial.
Easy. Thanks for coming straight off the golf course, mate. Had to skip your beer on the 19th.
Well, I actually can golf, mate, because I don't know about you. I've been having a bit of insomnia, so I didn't sleep till probably 3 in the morning and cancelled golf.
Far out, mate. Just because of the heat, or?
Nah, it's just stress, mate.
Oh, really?
Yeah, it's an overactive brain.
You're worried about my back?
I am. I just couldn't sleep. I'm like, is this guy gonna is he gonna PR next time he trains, or is he gonna stick to the method?
Mate, when the oven's hot, you got to get to cooking. When it feels good, you got to throw more weight on. That's CrossFit.
Yeah. Now we're operating on the web browser here, so is that okay? And I'll try not to talk when you talk.
Yeah, it should be fine. I'll try to say less, and if you do me a favor, you can say more. How's that?
Okay. Too easy.
Sounds good.
Yep, let's go.
All right, perfect. I'm recording, but I can easily edit that first lot out.
Okay.
Maybe I'll just show Rocky, but yeah, mate. Thanks for sitting down with me. Obviously, it's a new year, and I know we're pretty busy, and there's a lot of stuff that I want to talk to you about. Given New Year's, new resolution as return to sport preseason, and stuff like that, and the injuries that can occur, and sort of what you're seeing. But I think to preface that, if we dial it right back. Can you give us a little bit of a insight into what actually is an osteopath? What's the difference between an osteo, a chiro, a physio, a Swiss masseur, etc., etc.?
Yep, no worries, Ben. So that's often a question that comes up all the time, and I suppose in the context of Australia, an osteopath is a APRA registered practitioner. So we're an allied health practitioner, and so if we look at, I suppose, allied health practitioners, there is osteopaths, physios, chiros. What do we do? Largely, we work in private practice, and we help individuals that might be experiencing musculoskeletal complaints. So those typical scenarios might be low back pain, neck pain, shoulder pain. It could be sporting injuries, that sort of stuff. So all the things that you come to me for, effectively. And so sometimes it might be that traumatic type of injury, or it might be more of an overuse injury that could be sort of training or work related. What's the difference between an osteo, physio, and chiro? I suppose these days, if we look at an evidence-based practitioner, we should be all applying evidence as best as possible when we're working with our clients. So that means taking that sort of biopsychosocial approach. So looking at the whole person and then applying what would be the most appropriate treatment for that client. So for some people, it might be manual therapy at times in that early sort of stages of an injury, which could be massage, could be joint manipulation, stretching. It could be a range of other sort of techniques, but then it might be looking at, say, exercise as an intervention to try and help sort of restore the capacity of what's going on. So tendonitis, for example, will respond well to, or tendinopathies will respond well to exercise. And then we're needing to look at sort of, okay, how do we get this person back to their function? So the difference being, it might be our philosophical approach in terms of how we look at things. The training is slightly different, but essentially if we're working in private practice, we should all be doing a case history, going through a thorough assessment, and then it's probably just going to be our treatment strategies. What do we lean on to apply to that patient? And I reckon rather than looking at what the difference is between a practitioner, it's probably more, or profession, sorry, it's probably more looking at that practitioner and what's their approach, because you could find that you've got practitioners in each of those professions, and you might find that there's similarities and differences amongst all of them. You could go see 10 osteopaths and get 10 different treatments, just like you could go see an osteopath, a chiro, and a physio, and then get 3 completely different treatments. So it's probably more about the person you see.
Yeah. So if I have just come back to return to sport, or I've rolled an ankle or whatever at footy training preseason, how would I determine who the best sort of, like, which direction to head? Or are you saying? Okay. Yeah, go on.
Yeah, so how are you going to pick and choose? So I suppose, like anything in life, like if we think about the best way to get to some sort of approach might be word of mouth, like have a chat to people that are like you, have an interest in those sort of situations like you, be it exercise and that sort of stuff. because they're probably likely to maybe be able to recommend someone that might be more aligned with how you work and operate. But two, also do your research, have a bit of a read up on that practitioner, get a sense around, well, okay, what does this practitioner look and sound like in terms of how they practice and their style? Are they someone who's very passive, lay on the table and will just give you a massage and crack, make you feel great from a symptoms point of view? Or do they sort of have a sort of preference for obviously implementing exercise as an approach for that? So for you, you need someone who might apply some manual therapy at times, but then you also need someone to look at your whole body movement and then also look to help you in that pathway to be able to get back to that process of lifting heavy, and then obviously lifting heavy for repetitions and time, because we know that's what you love. So so it's building a robust body, and you need someone to help facilitate that process with you.
And using heavy as a relative term there.
Yeah. It's all relative to the person, yeah, because your goals are different to mine.
Yeah, that's right. All right, perfect. Some of the things that you kind of touched on there, especially where manual therapy is concerned, we've had a lot of banter kind of on the table about a lot of the myths that surround treatment, and not necessarily its effectiveness, but I guess some of the terminology that is used with it. I know I'm pretty guilty of coming in and seeing you and telling you, like, I just need you to crack this back in, or just like open this up. How much has that kind of just been overly simplified, taken out of context in terms of what's actually going on physiologically?
Yeah, I think, so when patients come in and they're sort of asking for this sort of outcome because they're looking for the magic sort of fix in one go, often that messaging probably starts with the practitioner at some point in time. And it might be that practitioner, as you say, just trying to dilute that into some type of I suppose, dialogue that makes sense to them in a simplistic term. But it also could be the, I suppose, patient sort of reading up and sort of interpreting that without any explanation. If we look back at sort of, 10, 20 years, 50 years ago in terms of, I suppose, the different professions and that sort of stuff, we used to use terms like, I suppose, subluxation and this sort of stuff, and sort of this idea of like having a joint that subluxes and that sort of stuff. I suppose that used to be the key way of maybe diagnosing and trying to describe what's going on. And we're sort of saying, well, we're helping, with this subluxation. However, stuff has evolved a lot, and what we say we do and what we think we do, I think there's a bit of a mismatch there. But I think we're getting better at being able to describe to the patient. The fact is, what we're trying to do is not necessarily deal with some of those, the way that we describe some of those issues. It's a tricky one because often we're needing to confront a person's belief around what's going on and obviously what's going to help that person. And sometimes part of that process is having a chat to them about their beliefs. And then if those beliefs sort of align with obviously what we suspect is going on, then great. But if not, then we might need to confront them with that to sort of give them a bit of an idea around, well, actually, this is not what's going on. This is what we think we're doing. And we're trying to apply to that particular complaint or injury and that sort of stuff. So when you sort of hurt your neck, you said, can you just crack my neck back in and that sort of stuff? In simplistic terms, if your neck was out, you'd probably be in hospital because there'd be some type of dislocation and that sort of stuff. So when we sort of, I suppose, communicate that we're going to maybe mobilize and maybe articulate and loosen off around that area and get that moving a bit better for you, and maybe we might apply like a high velocity, low amplitude cracking sort of sound. Effectively, we're just trying to help restore some of the movement, and we're also trying to help dampen some of the symptoms that might be going on with that process. So we're applying a symptom management approach to treatment there. So it can get a bit sort of murky, and if we go into the absolute details of it, it can get really confusing both for the practitioner but then for the patient. So often I think we've just tried to simplify it, but with that comes sort of maybe a misinterpretation of what's going on.
The Dunning-Kruger effect, mate. The knowing so little about a subject you think is super well informed from a patient perspective.
Yeah, totally. And to be honest with you, the longer I do this job or work as an osteopath, the more I realise I don't know a lot of stuff. So, this idea when we graduate, we want to use big terms and we want to describe this, and we think that's really important for the patient. But the longer I do it, I now just try and really simplify things and come back to the basics, because basics work well. But I also know that perhaps what I think's going on is probably maybe not necessarily what is happening there at times.
How would you as a practitioner determine whether you're going for, doing some dry needling as opposed to more manual therapy, or a crack, like a manipulation, something like that?
My screen just dropped out there. I suppose it comes down to the person and their complaint. What state are they in? Are they in like a really acute chemically irritated state or not? Just say someone's got a really sore neck and they can barely move it and there's a lot of pain there. I don't want to choose techniques that are maybe going to amplify the irritation of what's going on. So we might want to just maybe work above and below the area, just leave that area alone, let things settle down over that 48 to 72 hours. And that sort of stuff. So it could be depending on what current physiological state it's in. But two, I also want to get a sense around, well, what does my clinical experience tell me? What does the evidence show? But then also, what do you as the patient find works well for you? So we're sort of wanting to integrate all of those things in there. If you were to say to me, some gentle mobilization, some soft tissue and that stuff's been effective previously, then I might apply that at a point in time in your treatment and that sort of stuff, just because it will give us some symptom relief. But then I need to be thinking longer term, what's going to be useful for you so that I don't turn you into some passive type of patient that keeps coming back every week just to lay on the table and get treatment when maybe in effect it's not going to be the best thing for you long term.
Yeah. I just keep coming back to the chat, mate. Anyway,
okay.
That's all right. I was just saying, mate, for the most part, I just keep coming back to the chat more than anything else.
Okay. Good work.
No, ironically, my mic drops out. So.
Yeah, nice one.
But with recovery, definitely is becoming, almost a bit of a buzzword. There seems to be quite a massive push. Things like Theraguns, complexes, all those kind of muscle stims. Do they have their place, do you think, or are they just more of that kind of like, okay, we're just continuing to treat symptoms and not really look at like underlying dysfunctional movement patterns, et cetera, et cetera?
Yeah, it's a tricky one. I suppose you've got this. If you look at the evidence would suggest that perhaps you're probably having an effect on the sensory system or the nervous system in terms of maybe de-escalating some of the I suppose maybe that perceived feeling of stress and tension in the body and that sort of stuff. I do think that it can serve its place for individuals in terms of maybe for preparing for training and recovery, but I think people often overcook it. And I think clients that I might see might sort of start off with the right intentions and then everything morphs into maybe 2 hours worth of foam rolling and theragunning the whole body and this sort of stuff. And the more pressure means better outcomes. And I think people go a little bit crazy with that. If anything, if you're going to apply that stuff, you just want to apply it for a very short period of time. And if the goal is to obviously maybe sort of reduce tension or that feeling of tightness or so, just do it for a short period of time and that sort of stuff. Is it a high value activity to do? I think you're probably better off looking at maybe more active recoveries and that sort of stuff. So movement, for example, and that sort of stuff. If we're looking for, say, maybe some sort of pain management or sort of and that sort of stuff, you might be looking more again at active recovery and maybe some hot cold sort of intervention and that sort of stuff. It's an interesting one because everyone's buying these Theraguns and this sort of stuff and doing it for applying it all the time, and yet I suppose, is it having an effect or is it more of a placebo effect? That's the argument that I'm sort of often sort of wondering for patients and that sort of stuff. Like if you take you, for example, are you applying that stuff to your recovery process?
Not really, mate.
Not really. Okay. So how come you haven't bought into it?
Because a Theragun's like $800 for the most part is probably like my biggest thing. I'll foam roll occasionally, like if I'm squatting or something else, and like I might foam roll my calves or like barbell smash my quads before a squat session. Just I feel like it helps with range of movement and stuff like that a little bit. Takes a bit of pressure off the knees, but yeah, I'm definitely not doing 2 hours of self-manual therapy a day.
Yeah. Yeah, and I think if you're going to do foam rolling, you probably don't do it in isolation. You're probably doing a bit of foam rolling, and then you're probably doing maybe some isolated, movement at the area, and then you're obviously warming up with the task-specific component. So squats with low load, and then progressing up. Yeah. So
Yeah.
I think if you use it in that type of regard, where you're, I suppose, having multiple interventions to prepare that person for training, or so, then I think it's definitely can be appropriate. I just wouldn't just apply foam rolling and then go straight into training or so, because I reckon that probably has limited benefit. And then from a recovery point of view, yeah, you might do a little bit of foam rolling to maybe, I suppose, ease things up a bit, but maybe going for a walk and doing more active movement is probably going to be better, I think, in terms of, say, maybe helping that recovery process. It could be, go for a walk, jump on the bike, maybe do some, gentle movement or stretching, maybe in a yoga sense, or some dynamic movement can be probably, if not better than perhaps just foam rolling stuff.
All your appointments coming up, mate.
Yeah, that's right. Yeah.
All these complaints from people needing treatment.
They're all only looking for their massage.
You're warming up and you're cooling down. As far as like injury prevention is concerned, like I'm always been a pretty big proponent of like a proper warm up, like a very general warm up, and then into a more sort of specific warm up based on the task you're about to undertake.
Yep.
But that kind of like cooling down or like warming down, which is the most ridiculous term, but is that like worth still doing? Like we should be giving more time to that, or is it? I think what tends to happen is people will warm up, do their movement prep, do a workout, and then like lie on the floor after they finish their workout, knackered, get up, make a protein shake, and then straight into the car and kind of off they go.
Yeah. I reckon it's worthwhile doing to an extent. However, if I think about recovery, what are our key recovery tools that people don't get enough of? Sleep, probably adequate nutrition and hydration, like just focusing on the basic stuff. If we can do that better, like those things there are going to have much better value than perhaps, that sort of stretching afterwards and dynamic movement afterwards. Because I reckon we focus on these little 1%ers, but if we have all these other things going on, they're probably much better value for money. If you're already doing sleep, nutrition, hydration, you've got smart programming with appropriate rest breaks between your training, and you've mastered that stuff and you're killing that, then yeah, go for that sort of, I suppose, recovery process that could be movement and stretching and sort of symptom relief with your foam rolls and that sort of stuff. But I reckon most of us forget about these key things here, and we spend maybe too much time on the other stuff. So yes, it's important, but I reckon get your other shit sorted first.
Yeah. Coming into pre-seasons and stuff like that, do you tend to see a rise in the 35-year-old hamstrings that tend to get pulled off the bone in the first 1 to 2 weeks?
Yep. So pre-season training, I see, and this goes for all sports here in Melbourne, obviously AFL. You will see an influx in overuse complaints. Typically, that's a combination of the person's gone from doing nothing to ramping up to lots of activity. So our load is too much. We also then need to take into consideration other environmental factors, like the surfaces that they're training on can be particularly hard. What sort of footwear are they using and that sort of stuff. So we do see lots of overuse complaints come in. And it's often just a matter of too much too soon without a graded build-up and exposure to that. And that'll be your shin splints or your compartment syndromes, your plantar fasciopathy, Achilles tendinopathy, knee pain, that sort of stuff. So each sport's going to be a little bit different, but we do see lots of that. And for some reason, it's always the same people. They're always coming in every year, having the same recurrent episodes. So there's a lack of learning effect here. So I don't know, maybe genetically they're just more predisposed to that, but I also think that maybe they're not reflecting on their practice and maybe considering that when they go to their next pre-season.
Yeah.
Yeah.
So the longer the build up into training, the better. Starting super slowly, super small, and then amping up very slowly is the way to go.
I think if you're a Gen Pop client, depending on what your sort of, I suppose, baseline of activity is, and we need to consider your job and all these other factors that are stress points on them, a gradual build-up of exposure is worthwhile. So if I take let's just take, you've got your corporate office worker and then you've got your hospo worker. So your hospo worker's on their feet 50 hours a week, versus a corporate worker. They both start footy pre-season. The hospo workers already got a degree of stress and strain occurring or loading through their body because they're on their feet all day, but they've also got an element of conditioning there versus the person who sits in the office all day. They've got, I suppose, a lack of exposure to conditioning because they're not standing as much and moving around, but they also have less stress or strain on the body. So as we sort of start that pre-season there, you might find if that person who's on their feet all day has an element of conditioning, they might cope better with that increased load. But if they're already at a threshold where they're sort of maybe, I suppose, building tension and other stuff, and then they increase their maybe activity too soon, then they might start to also break down in terms of, say, get symptoms because they don't have that recovery or that ability to recover because they're on their feet constantly and that sort of stuff. So it can sort of go both ways at times.
So if you've been pretty quiet over the off season, maybe don't start with a 10K run back on day one.
Well, if you do, make sure that you know where my clinic is, so then I can obviously assist in that symptom management and return to performance and that sort of stuff. You just want to start with like a slow amount and build yourself up gradually. It's simple, but it works.
Easy segue, mate. Give us a bit of a plug. Tell us a little bit about the clinic.
Okay, so our practice is Principle 4 Osteopathy. We're located in the heart of Melbourne CBD. We have 4 great osteopaths working from the practice, open Monday to Friday. We have a gym as part of our clinic. So we will do obviously some table-based treatment and intervention if appropriate, but also we love movement and we want to integrate that stuff into our patients' treatment and management. So who do we see mostly? Generally quite active people in the gym, crossfitters, powerlifters, that sort of stuff. So often it might be looking at technique. It might be looking at helping build someone's capacity up. Say, for example, with your back, it was more like, let's go back to some fundamentals and add some of this in to layer in with what you're doing so that we've got a more robust sort of body so it can handle the stress that you like to put it under and that sort of stuff. So we're very goal orientated around what that person wants and needs, and we really focus on working that person towards their goals. So that's a short little plug about what we do in the city.
Yeah, and your handles on all the socials, you guys are on. You're pretty proficient on Instagram, or prolific rather, aren't you?
Yeah, I try to be a little bit. I'm probably just mostly on Instagram. So just go to Principle 4 Osteo, and then you can follow a bit about what we do at the practice. So I like to post up videos of what some of our clients are doing so that you can sort of showcase that we're not just these elite athletes. You've got 60-year-olds, you've got 20-year-olds, you've got people that sit at the desk, you've got people that are super active, and also like to show a little bit around how we work and operate, what do we do in our training and that sort of stuff, because I think that's also helpful, just to showcase that we try and live and breathe a little bit of what we try to get others to do.
Yeah, I think it definitely makes a big difference, even in terms of your confidence in your practitioner when you do walk into a clinic and there is a gym in there.
Especially if you like a gym, but if you didn't like a gym, then you might not like coming to our clinic.
That's right. But if you're probably not enjoying the gym, you're probably not doing too many overuse exercise injuries, right?
Yeah, that's right.
And what's the future for you guys? I'd see you over COVID have been doing a lot more like package stuff, like online learning, all that kind of stuff too. Is that sort of the direction you're looking to head and open up?
Yeah, I suppose COVID's obviously had a big impact in the CBD because there's obviously limited people in there. So we've moved to a combination of telehealth services. So that's worked really well from a exercise prescription and assessment point of view, because we can apply that to anyone anywhere in the gym, and we want to look at how they're moving. But we've also we've got a bit of an interest in education, so we're putting together packages more geared towards the allied health practitioner, personal trainer, exercise scientist, and that sort of stuff. Just looking at sort of exercise prescription and regression progression. So we want to upskill practitioners in this space so that when patients go to see them, that they can apply active interventions through exercise and that sort of stuff to better help their clients. So I think there's a gap there in some of the training, especially within, say, osteopathy, that gets covered to a small amount. And unless that person has a real personal interest in exercise, generally we will default to table-based treatments. And I want to upskill osteopaths in that space particularly.
Yeah, it would be hard to be in that field though and not be a fan of like exercise and movement though, right?
Yeah, I think so, but I think people's biases will sort of lead them down the pathway of where they want to operate. So I suppose when we think of osteopathy, like how you work as an osteopath is entirely up to you and what your interests are. You can go down so many different rabbit holes there. So if you're not an active moving based person yourself, then you can totally shy away from that aspect of your treatment and management with the patient. So you could turn up there and see someone and get your back massaged and cracked and stuff, but not have any discussion around exercise, technique review, why might your body be breaking down in the training that you're doing, and that can be totally not focused on, and that sort of stuff. So I suppose what the evidence shows is that we need to be incorporating that stuff into our treatment and management. And I think our goal there is that even if you don't have a big natural affiliation with movement and exercise, we want those people to sort of at least be aware of who to sort of send people to, or what to prescribe, or what to consider when someone like yourself as a CrossFitter pops into that clinic, so that you can have a better, longer lasting outcome.
Awesome. Cheers, mate.
No worries.
Thanks for the chat, and no doubt I'll see you soon.
Excellent, thank you, mate. So obviously, if you just make sure we implement those basic movement prep exercises into your program, and then also just try and obviously not always do stuff for time. I reckon there's a good chance I won't see you.
Maybe I'll do it on purpose, mate.
That's it.